a muscle issue.
Okay.
This is a biomechanics issue. This is a nerve issue. This is a kinetic chain issue. So you stretching a single muscle is not going to make it better. So I'm going to show you some stuff.
Where are my glasses?
Yeah,
For sure.
they're up here.
In my jacket, yeah.
You cold?
No. Oh, there we go. Just, I thought I left them
That's
inside
all right.
the pocket of my glasses. Thank you, Eric.
No, that's perfectly normal.
Sweet.
All right, so I guess the first thing I noticed I'm going to go top down.
Okay.
And not necessarily in a hierarchy saying this is the most important, this is the least. Definitely top down, you're having the most issues when it comes to tenderness between the L4 and L5 area. Maybe even a little bit of L3, but definitely L4, L5, because I went to the L4, L5 interspace, like, which is where, like,
right.
And I say interspace, that means the space in between both of those segments. We go here and here. Okay,
Right.
what's in between?
Yeah.
That's this. You had some good amount of tenderness there, and really a lot of tenderness within there. An L4, L5 compression to the spine will indicate and cause nerve pain associated with the L5 nerve root. The L5 nerve root is this.
Okay. Yep. That would make perfect sense.
That. You're not having, at this point in time, significant weakness associated with that. Oh, and by the way, I forgot to tell you, L5, S1 will be associated with the S1 nerve root.
Okay.
This, bottom of the heel,
Wow.
and then the outside there.
Wow.
So, if I had to choose which one is the problem, according to that, I'm going to say neurologically, we're going to say the S1. Why am I saying neurologically? Because you had the most weakness there. You're able to do play the drums, but you're not able to get up on the toes.
Gotcha.
So the question then becomes, in your gait cycle, when I watched you walk, were you swinging this hip out and around and not using your hips and pelvis as a result of pain, or is it a result of weakness?
Weakness.
I think it's more just weakness.
I do too.
I don't necessarily think it's pain. When you do hip flexion, we're talking about L1, L2, L3. So, and by the way, when I say L1, L2, 3, this may sound foreign to you. Really what we're talking about is the nerves that come out. And a lot of times we talk about the sciatic nerve.
Yeah.
And the sciatic nerve is a distribution between L4 and S3.
Okay.
So it's pretty much...
That would make sense.
So if we rotate this bad boy in the front,
Yeah.
we literally are covering all these nerves
Wow.
that go through here.
Okay.
So as you know, these nerves go down into the leg and they irritate and they divide,
Okay.
right, at this area.
Yeah.
I tested you with these weird tests going this way and this way.
Right.
You had a mild positive going straight up. So a lot of people think I'm like, when I go and lift the leg, I'm doing a like a hamstring stretch. I am, but I'm also coming down and trying to tension and pull down on that nerve here.
Gotcha.
Then when I kind of rotate it going inward, I'm really testing the outside distribution of that nerve. You kind of had a little irritation there. But again,
Not as much.
if we kind of, like if we just quote open the book here, it says
Right.
L4 to S3. Shocker, same thing.
Right.
So guess what? When I click here, L4 to S2. Okay, we eliminated that.
Gotcha.
Okay, well now we have L4 to S3. So what's the common root? L4, L5, and S1, right?
Okay.
By the way, 90 to 95% of issues neurologically in terms of low back issues and disc compression and disc herniations and things like that are based off of L5 and S1.
Okay.
So L4, L5, L5, S1, which really just means L5 and S1 nerve root irritation.
Okay.
If we kind of go back to where the heck that really means, we're talking about this nerve root here, and then that nerve root right there, like
Okay.
right there.
Okay.
So here's L5, sorry, and then S1 down there. So
Wow.
so that's first things first.
Okay.
The joint in terms of your hip. So again, remember we're working the kinetic chain. I'm trying to be very unbiased, and I'm trying to say where the heck is the most pain here?
Right.
Where's the heck is the most pain?
Right.
I did a lot of the testing for you neurologically. I even tested the femoral nerve that goes down the front. You were just
Yeah, yeah.
really, really tight through here,
Right.
but you did not have any irritation there. If I said you had to have irritation, I would say you had more irritation on the back side there. I think that would be fair to say. Here and here.
Yeah.
Um,
Definitely.
you do have when I did you do have tight hip flexor. By the way, if we look at the hip flexor, which is the psoas major, it is extraordinarily important, and it actually attaches to the hip. It actually blends in with the iliacus. That's where I kind of pulled your hip back on the other side, and you're like, oh my god.
Yeah.
I'm also trying to test the femoral nerve going down. That didn't irritate it. But the hip flexor actually attaches to the front of the spine. So what does that mean?
Yeah.
It's probably just locking up.
Okay.
You definitely have lost glute strength.
Yeah.
You definitely have lost hamstring strength.
Definitely.
If we kind of go back to the hamstring strength, we look at the nerve roots. They kind of associate that. We're talking about the tibial nerve and this, which is a portion of the sciatic, and then we're talking about the glute max, which again is an L5 and an S1 as well. So basically, everything is kind of pointing towards those
Okay.
at this point, and I think it's affecting how the strength of your entire issue is. So if you said, hey, get an MRI today, I don't think you necessarily need it yet, but it wouldn't hurt.
Yeah. I'd just like to know what I was dealing with so I can address it. I mean, is it arthritis? Is it?
I think
mean,
you're
what
having
is it?
some.
Is it,
I think you're having a compressed nerve root at the lower back levels.
why is it compressing? Am I deteriorating? Is
No.
it inflamed? Is it?
It could be just time. It's associated with some just degenerative changes. It's normal. It just whether you have symptoms or not. Which now goes back to your first thing I said. You're onto something at the beginning when you're cycling.
Yeah.
You're quad dominant. Why are you quad dominant? It's because you have no other choice now. You literally don't have the muscle strength back.
Oh yeah.
And that's why you. Sorry.
It hurts. That's
Yeah.
crazy how much it still
Yeah,
hurts.
and
It's
so-
been months.
And it probably feels like a deep, dull, achy pain, right?
Yeah.
And that's signals that the muscle or the nerve that powers that muscle is kind of shut off a little bit. I tested the hammy. I tested the calf. The good news is that the L5 nerve root, the drumming one that I told you to, is fine.
Fine.
I think there's just a little irritation of it.
Right.
So if you said, hey, do one thing only, I'm going to work your back.
Okay.
Do I think adjustments are going to help it? I don't know yet.
Yeah.
I personally don't like to adjust those issues right away, especially when somebody's having nerve-based irritation and motor loss. That's the big concern for me, is that you're having some motor loss. Now, I don't think that's a bad thing. I've seen it come back because you're not in a lot of pain. If you're in a lot of pain and you're having severe motor loss, I'd say, hey, we got to refer you out right now.
Yeah.
I'd say give it a couple weeks. If you get like 5% motor function back, 10%, high five, we're heading in the right direction. This could affect circulation too.
Yeah. My leg was freezing cold like a meat locker compared to the other leg, and that's what they figured out was maybe it was the nerves because it was so cold. And
Yeah.
acupuncturist did everything.
I did test the integrity of your hip and everything. Surprisingly, you have really good hip motion.
Okay. Yeah.
I think that when we kind of lift it, like the standing test that you kind of like dip like that,
Yeah.
I think that's just more of an incidental finding. I think you're just like weak and your body's trying to like really work
Give
harder.
me some muscle that works to use.
I don't really think that's a big issue. I was just seeing if like your pelvis would stay stable and if you can balance on a leg and all these other things, and
And I can.
you can, but
It just doesn't feel stable.
no. Well, that makes sense. You have literally loss of neurologic muscular. So now that I'm taking these individual pieces, summarizing, it's actually making more sense to me speaking it out.
Okay.
So it makes sense. Like if your calf is weak and you can't do this, how are you going to do mid stance?
Right.
Heel strike, mid stance, toe off. How are you going to toe off
Yeah.
to get the power for the other leg to come through? You're not. So what you're going to do is this.
Yeah.
And you're going to
That's
use
exactly
your hip
right.
flexor, which is over tightening right now. And shocker, it's over tightened, right? I tested the integrity of the knee. I know you had an MRI. I'm gonna pretend like you never told me anything.
Yeah.
I tested the LCL, the MCL, the meniscus, even the hinging pattern. Everything looks pretty good.
Okay.
I think the knee's the messenger.
Yeah.
Somebody's trying to kill the messenger.
Right.
When this isn't working and you're swinging the leg like a big giant tree trunk and it's landing funky and it just so happens to have this hinging joint in the middle, I think you're just adding a little bit more irritation to it. Makes sense now why your leg on the left side is curling in a little bit, like we call it inverting.
Right.
It's because you can't do this. So where are you getting the muscle strength from?
Oh. Okay. Wow.
So I really, and by the way, I tested these, and I tested these, you were super strong on both of them, which is part of the L5. So the L5 area, I believe, is overcompensating and working harder, which is probably why, if I had to guess, and we never even talked about this, if you felt more pain, discomfort, or you're probably feeling more pain and discomfort through this side, because you're overworking this side.
I'm getting ankle pain, and that's funny because I was.
And that's
just
new, right?
Yeah, it is very new, and I just
since you started walking again, right?
Yeah, I just thought.
Shocker.
Oh, yeah.
So I believe that this whole analysis, like if I had to quote, take out your legs from down below, I would still work up there.
Okay.
So, yeah, and just so we look, here's the common peroneal nerve. It does split to become the deep and the superficial. The superficial peroneal really does the outside of these muscles here. The deep peroneal does a lot of those extensor muscles that we were that you were super strong on. So I love that. This is more the L5 region. We could still say there's an S1 nerve component, but generally speaking, if I had to choose L5 versus tibial component, you're really talking about S1 there. That's more of the issue. Everything has an overlap, but generally speaking, I think this makes a lot more sense to me at this point in time, based off of all the crap you've been through. So.
And so then probably staying off it for the month that I did probably helped it heal because it was a little bit. Okay.
I think we just need to work a little bit more of the lower back and be more specific. You also had pinpoint tenderness right over that spot. And by the way, when I poked into the middle of the spine, you actually said you felt it on the left. So you're having some sort of compression. Let me grab my spine. And this is just a very representation.
Gotcha.
But when we have that compression going forward, what can happen is you can feel that irritation out to the side going down. So I really think that this is a little bit of a compression going on the nerve that's long standing since February or so February, March, April, May. Let's just say 5 months. I really would like to see some aggressive improvement soon. Otherwise, I'd say let's get an MRI. Why am I being conservative and saying let's get an MRI even though this is your first time? Because I don't like when people have to suffer for longer than they should, and I'd rather have more information, and I'm very conservative, just so you know. Like, I don't play around, and you can probably tell, I just shoot it straight, and if you're not getting better, then let's get the damn MRI, because if you're not getting better, you're getting worse, right? Especially after 5 months. But let's give it a couple weeks, see if we can feel any better. If at a couple weeks, we can call up and say, let's get an MRI. We get the MRI, great. We have added information to go on. If not, if we don't find any information, then that's fine. I just don't like when somebody has motor loss. And now, are you having motor loss from direct severe compression? By the way, you still have strength. It's not like you don't have strength, just so you know. You just have reduced strength. So that's why I'm not like red flag. This is a yellow. This is like, go in the water, there's strong rip currents, and maybe some stingrays around there. Shuffle your feet and wear a life vest. It's not like, hey, this is,
I've come a long way. I was going to say,
So, which makes sense why you're kind of really, like, naturally kind of rounding your feet now.
Okay.
Because, like, these muscles are just, the muscles on this side and on this side have just completely worked overtime. Which is why you're easily to do the drum air, but you can't do the leg rest.
Okay.
So.
Yeah, and I just even sleep.